Good morning, everyone. I hope you're all doing well today. As Anna said, today we're going to be talking about modernising the NHS patient flow with the booking system in particular. But we'll concentrate on booking systems, but we'll also talk about broader workflows as well. So first things first, let's make sure this is all working correctly. Lovely. Great. So again, lovely to meet you. I'm Jacob, Head of Business Transformation. Now, what does business transformation mean? Well, from 10 to 8's perspective, I'm responsible for the team and also responsible for particular clients in implementing 10 to 8 patient booking systems across NHS Trusts, but also globally within US healthcare, across European markets, and also within areas such as the Middle East and Australia as well. Today, we're going to be very much concentrating on the NHS and the work we're doing there, and particularly work that we've picked up over the last year, and hopefully it'll be as relevant as possible for you. So firstly, we're going to talk about North East London Foundation Trust with a really interesting use case about how we've helped them modernise their patient flow with self-service bookings. We're going to talk about the Nottinghamshire CCG that use 10 to 8 within their trusts to automate scheduling for mask fitting, PPE fitting, etc. Obviously, something that's become very apparent over the past year. And then finally, we're going to talk. We're going to have Ellie, who's not here with us today, obviously, but we've got a quick video from her. She is the outpatient manager at Chelsea and Westminster Trust. We'll have some polls, we'll have some feedback, we'll make sure to leave plenty of time for questions, etc. So if you do have any questions, feel free to ask them along the way, or you can save them towards the end. Great. Well, let's get started with the first use case that we're going to talk about then. Let's talk a little bit about modernising the patient flow within North East London Foundation Trust. When we first started speaking to NELFT, as I refer to them, they had some very specific problems. They were struggling with crowdedness. They are a phlebotomy clinic, so we had big crowdedness issues, and obviously over the course of the last year, crowdedness was by no means an option. So we had to help them clear out their walk-in clinics. We had a backlog of booking requests. They had 2,000 email and phone call requests that was growing by over 100 requests per day. As a result of that, things were going missing. Patients weren't getting seen. At the loudest, the patient that shouted the loudest at times was the one that got seen first, which of course isn't part of the experience we want to offer. And they had a heavy workload from the admin staff pressure from what we've seen above. That resulted in the CCG actually allocating 10 members of staff to manually help them manage their appointments and reduce their backlog. Now, we've been introducing this software over the last 9 months alongside Sanjeev Lakhia. He's the assistant director, runs the phlebotomy clinic over at NELFT, and he's been fantastic and in sort of getting that buy-in really, which has been great to see. Now, what was the solution that we offered the NELFT team? Because we know that having 10 people managing an admin backlog was by no means a long-term sustainable outcome. So 10 to 8, what we did was we implemented a self-service patient booking platform. We introduced an auto reply from referrals. So what that means is when a patient was referred to the phlebotomy clinic, they were told, send an email to get booked in. As a result of that, they would then get an auto reply where they would be able to select their own slots, be able to enter all of the correct information. They could obviously still call central desk as well, where they would make bookings into the same system. So everything was going in via a centralized place, which was highly optimized. And then we also help them extract the behavior insights with 10 to 8 reporting tools as well. So patient demand, looking into busy times, how we optimize capacity, how we optimize appointment times, looking at the DNA rates, etc. Patients being able to reschedule and cancel, how many patients are doing that. We gave full visibility on all of those things for the first time that they'd had at the clinic level. I think, we're probably aware that this data is often available at the sort of CCG level, but is it available, for any person working within the clinic that wants to sort of, look at data insights and be able to manage that data correctly? And what was the results? Well, firstly, in less than 3 months, we'd increased their booking capacity by over 100%. I think they didn't actually realize that if they optimize their booking flows, how many bookings they could actually end up taking due to the amount of lost time. So I think we went from roughly 2,000 appointments a week to 4,000 appointments a week, which is fantastic to see. We've done over 100,000 blood tests in the last 6 months. We saw a huge surge in the sort of July, August time, and we're now seeing a really large surge again, obviously with lockdown restrictions being lifted slightly. And on a monthly basis, we have calculated, and this is a low number, this is an at least number, we're saving them at least 28 days per month. So for a full person per day, 10 to 8 is now managing all of this. So it's been a real success story, and we're really proud of this one because we've helped reallocate, I think, 8 members of those 10 members of admin staff within the CCG into other departments, into other areas within the trust. So it's been fantastic to see us have that effect. Next, we're going to have our first poll question. So I believe Anna will probably pull up the poll question within the window, so you'll be able to see it. So the question is, are you struggling to implement effective changes because you don't have a way of gathering insights into patient behaviour? This could be in the likes of forecasting demand, crowdedness, missed appointments, or just overall clinic performance. Back to me then. So let's look at a second use case that we've been working with the NHS. This is a really interesting one because it's one that just didn't exist over a year ago. So this is something that has came to light, I believe, in sort of end of March time last year. Unfortunately, with everything going on with the pandemic, we had the automated scheduling for mask and PPE fitting within the Nottingham CCG group. Of course, this was having to be done on a mass scale that had never been achieved before, and they had really big problems. This problem was that this used to be a manual process. PPE was obviously something that is allocated within trust, but not quite at the scale that we had previously. So organising face mask fittings on a large scale with the exact same output and team was really difficult. Forecasting demand and crowdedness was to keep the staff safe. So how do we make sure that we don't have too many staff from different departments and different zones on site within this relatively small area in the fitting area at one time? And how do we optimize the staff workflows and within the CCG budget allocation? We've been working with Thomas Kinraid, who is the PPE manager over at the trust, and he was fantastic at implementing this. He really picked it up and ran with it. So it was amazing to see what him and his team could achieve under a lot of pressure, actually, and they could implement and adopt solutions so quickly. So what was the solution for this? Well, firstly, we set up a private booking link or private booking page that was sent to the care providers and put on news bulletins. We gathered information safely in advance. So 10 to 8 has customizable booking questions where you can have opt-ins and mandatory questions such as symptom checkers, etc. at the point of booking, which was really good, which means the team could always check who was coming on site, what department they were in, if they'd had any symptoms, if they'd been in contact with anyone at any point. And then finally, we allowed them to gain insights with the 10 to 8 reports. So again, we helped them forecast busy times. We helped them allocate resources. We gave them data on the ground that maybe they hadn't always had beforehand, which is amazing. And then finally, the results of, well, it equaled weeks of work saved, and this is Thomas's words, not mine. We took care of the whole admin process. So it wasn't a case of we still had admin staff allocated to this. It was actually all managed by 10 to 8 end to end, which was fantastic, so that other team members could be allocated elsewhere. So as you said, it's NHS budget well spent. We didn't have to have full-time members of staff on this. And then finally, the use case was then expanded. It worked so well that they then moved into things such as COVID antibody testing, internal staff member testing. All of these things are really great to see the trust as a whole pick it up and run with it. As much as we had so many different members of staff there over that period that I think we saw lots of opportunity for it to be expanded into other areas to keep staff members and patients safe. So we've got another quick poll question here, which Anna will bring up in a second. This is always a really interesting one because I think we've seen with the COVID fund over the last year that this has maybe changed things slightly than previously. Did your NHS Trust have to quickly implement a software solution in the last 12 months to deal with the implications of the pandemic? So that could be patient booking, that could be virtual queuing, it could be reminders, it could be patient management systems, it could be any number of things. Perhaps you moved more virtual within some of your appointments. Lots of examples there, which is always, I'm always really interested to hear about how they've implemented it and if they have, and which trusts have really adopted new technologies which have decided to stay the way they are. So let's have a quick look at the final example we've got for you today. Now, don't worry, you won't have to listen to me for too much longer. We're actually going to hand over to Ellie from the Chelsea and Westminster NHS Trust. She also runs a phlebotomy clinic there, and she's got some really interesting insights. So I believe, Anna, you're going to take over from here, from my understanding, and just share a video.
Yes, that's right.
The phlebotomy service at Chelsea and Westminster and West Middlesex hospitals isn't particularly big. We've got 3 to 4 stations at each site that run from 8 till 4:30ish. But because they're not particularly big, we also have quite a small waiting area, and trying to ensure 2-metre social distancing in the waiting area was proving impossible, to the extent that some days between the first and the second wave we had queues down the corridor, which also wasn't particularly good for social distancing, because that's the main corridor through the hospital and through to the outpatient areas. So our main reason was around social distancing and making sure that the flow of patients into the phlebotomy department was constant. So we worked out that we could see the same number of patients each day by putting in an appointment system and only ensuring that 4 people turned up in any 15-minute slot. So we looked at 2 different things. We looked at 10 to 8 and other online options for booking. The reason why we went with 10 to 8 was firstly because of the cost. It was a very affordable solution for what is quite a small phlebotomy department. But the second thing was also the simplicity. So other systems might offer check-in and telephone booking and all of those kinds of things. But going from a service that is purely walk-in with the patients not having any need to do anything to asking them to make a booking before they came in, we wanted to make it actually as simple as possible. 10 to 8 gave us that ability to literally just replace the queue that was going down the corridor with a virtual queue, with the patients being told to turn up no more than 5 minutes before their appointment and collect a ticket when they got there. And that was really important, the lack of change in workflow phlebotomists and the lack of change in workflow clinicians. Because phlebotomy is a 5-day-a-week service that is open from 8 till 4, there was no ability to shut the department for clinical governance half days, whole team training on important things like deprivation of liberty or the Mental Health Act, basic life support training, or even just for an hour's team meeting. We always had to exclude a couple of people from the team meeting in order to ensure that we were keeping the department staffed. So for me, there's the kind of practical things around staffing and social distancing. But what I think is going to be valuable in the long term is the ability to ensure the training and the quality and the teamwork by being able to close the department even for just short amounts of time in order to get those team meetings and those quality meetings in.
So that was it from Ellie. This short interview is part of a much longer discussion with her, and we are happy to share a bit more of it if you reach out to us, and we will ask about it anyway when we follow up. But the next poll is here, so here's our final question, and back to Jake.
Good stuff. Okay. So the final question for the day is, I agree that an automated patient booking and reminder system would improve my clinic's performance. So this wouldn't, you don't necessarily work in a clinic, but wherever you work across your trust, I'd be really interested to see, how you see the value of not just what 10 to 8 does, but, how managing patient flow, managing patients in general would be really interesting to hear a little bit more about. All right, so like we mentioned earlier at the start of the call, 10 to 8 is used by over 100,000 businesses across the world, I think in over 100 countries and maybe something like 16 languages now, I believe. And I wanted just to take a quick moment, just talk a little bit about broadly where 10 to 8 is used in other areas, because it's always good to take best practice from other parts of the world as well. So 10 to 8 is used really heavily within remote consultation. So avoiding crowded clinics, keeping staff safe, using Microsoft Teams, Zoom, telephone meetings, as a whole, so that we can take what maybe used to be a face-to-face consultation, but in the current times we want to make a sort of telehealth consultation. Ten-to-8 is a brilliant tool for managing that. Urgent GP referrals, we have many GP referrals across the UK. Those who want to refer into a centralised trust or hospital, referring to specialists, etc. Ten-to-8 is a brilliant tool for doing that. We offer things such as those private booking links, those dedicated booking pages, and those custom booking flow questions. And then finally, of course, a use case that we've all been a big part of over the last year, COVID tests, vaccinations, etc. Ten-to-8 is used for mass on-scale flu jabs, vaccination appointments, COVID tests, etc. Anything that really has anything to do with scheduling short appointments at scale, sending reminders to patients to increase engagement and attendance. Ten-to-8 is a brilliant tool for managing. So yeah, I believe that is it. So probably, Anna, if you wouldn't mind bringing up the results of the poll now, I'll probably just comment on that quickly, and then we'll make sure to leave plenty of time for questions.
Yeah, of course. Here you go.
Brilliant. Okay. Well, I think, yeah, this doesn't necessarily surprise me in terms of the patient behavior. The majority of people sort of saying that they need more insight to make better decisions. I think we all do on a daily basis, no matter what our function is. Being able to access the data quickly, I think, is half the battle as much as anything. There is always the data there within trusts, I've found. It's just, how do I access it? Can I access it by one click of a button? Or is it something that I can view on the spot rather than necessarily having to go internally, make requests from IT, getting a report on a weekly basis. And I really see that's where the value is of most software tools, not just Ten-to-8, to be honest with you. So yeah, really glad to see that everybody knows they need to more data for patient insights, and hopefully systems such as Ten-to-8 and others will be able to get it for you and make it simpler. All right, great. This is really interesting. We've got a slightly bigger spread here with the majority of people saying, yes, we did implement a solution. We'll continue to use it after the pandemic. That's great to see. I saw things such as Microsoft Teams and those sorts of tools being really heavily used. So that's awesome. It's great to see that maybe something that came out of that initial COVID response fund that just allowed us to move quickly through the process maybe could be used further down the line, which is brilliant, and hopefully it makes your life easier on a daily basis and allows you to provide better patient care. So one of the we'll revert back. I'd be really interested to see what you were trying to implement and maybe what wasn't successful, and whether we feel like that was maybe an adoption issue or maybe a functionality issue, because they're two very different things. So that's a really interesting point. And then no, everything stayed the same. If it ain't broke, don't fix it. But there's also the matter of, everyone was so busy. I think finding the time to implement something new, it does take time, does take commitment, and it is really difficult to do, is when you're dealing with a pandemic and trying to offer, that top level patient care that everyone knows the NHS does deliver. So that doesn't surprise me either, but really interesting spread of results there. So we've got, quite a lot of the participants have sort of said, we see the value, but we haven't implemented anything yet. Well, that's our job. So don't worry, it's not by no means the end of the world. We can, if you do want to speak to someone from Ten-to-8, I'll make sure that you have the contact details of somebody within the team that will reach out. And if you do need any help, or you do want to talk about your needs and just go through sort of 30-minute consultation just to see, is this something that is valuable for us? And the final one that I saw is, it sounds too complicated and expensive. Now, it's a very fair point, because software is normally quite complicated and can be very expensive. However, I think we'll look at the example of the North East London Foundation Trust. From Ten-to-8's perspective anyway, we launched them in 14 days. So end to end, from the day that we said, right, we're ready to go, and from the day that we were at max scale for taking bookings was 14 days, which was amazing to see. And in terms of costs, I mean, if you're taking a clinic from 2,000 to 4,000 appointments per week, and you're taking 8 people off the job, I would say Ten-to-8 speaks for itself in terms of return on investment. But again, if you do feel like it is complicated or it is too expensive, I think a quick 30-minute chat with someone within our team will be able to break that down for you, so you won't have too much time wasted, and we'll make sure that somebody gets you all the answers you need.
Great. So I think it is time for questions now. And we have a couple of really interesting ones. One of them, which you already started kind of addressing, somebody asked in the chat, how long does it take to get set up with 10 to 8? And what's the onboarding process like? Do we help with the onboarding, or will the NHS Trust need to do all the work? So yeah, that's our first question.
Yeah, sure. So as a part of that, you get a dedicated customer success manager at 10 to 8 who picks up a lot of this, helps you run the project and implements it, to be honest with you. So the implementation is very simple, very easy. Like I said, it takes roughly anywhere between 14 to 28 days, depending on the size of the use case. But we're getting very good at deploying them faster and faster, and we're seeing really good feedback, which is great.
Great. So here's another one. How many bookings can 10 to 8 facilitate?
Sure. So 10 to 8 is a cloud-based software. So it's hosted on Amazon Web Services, and it's obviously GDPR compliant, based in the UK. But because it's created on sort of what we call like an Elasticsearch system, it has no real limitation because it's scalable. So we have accounts taking tens, hundreds of thousands of bookings, and I think our 3 clients alone did sort of millions of bookings last year. So even the businesses that are using 10 to 8 on a micro scale are taking millions of bookings across them. And then within the sort of enterprise space, I don't think you'd have any problems with scalability and functionality, because that's what we're built to do.
Great. Another attendee asks, other than phlebotomy, what types of clinics can use 10 to 8?
Yeah, it's a fantastic question. I think we haven't really seen any patient-facing use cases that 10 to 8 can't facilitate. So, we've got things such as maternity, physiotherapy. We've got working within particular X-ray departments, etc. So all of those things, 10 to 8 is used across. It really isn't. The only place I haven't seen us use is maybe within sort of emergency care as of now. But if you go and speak to sort of most trusts across different parts of London, we've probably got 10 to 15 different use cases, not necessarily trusts, but across those areas, we've got plenty of scope that we can talk to you about.
Great. We are almost out of time, but I think we have time for one more quick question. Oh, here's an interesting one and very important. Does 10 to 8 comply with the NHS information governance standards and similar security regulations?
Yes, absolutely. We're part of the GSP toolkit, so we're signed up via the cybersecurity toolkit. We've followed all of the processes, crossed all the T's and dotted all the I's, I guess you'd say. So it's very simple to be from that side. So we're all covered, which is great.
Cool. Well, thanks again, everybody, for joining us today. We will be following up in a couple of days with the recording, of course, and answering the questions. And we hope that you enjoy this webinar, and we would love to hear your thoughts on what you'd like to hear more about in our next webinar, because there will be more of this. And yeah, I wish everybody a really nice day, and hopefully see you next time.
Thanks so much. Speak to you soon.